Today we will be having a brief discussion about breast cancer awareness. I usually like to start with a brief about cancer as a topic because cancer is something that is associated with the fear of the unknown. It's not something that people know very much about. And when we don't know about something, it makes us all the more afraid. My screen visible? So what is cancer? Cancer is the uncontrolled growth of abnormal cells in the body. These cells can form tumors, invade nearby tissues, and spread to other parts of the body, which is called metastasis. It can affect any organ or tissue in the body. There are certain things in cancer studies which are called hallmarks of cancer. This means changes at the cellular or genetic level that allow these cells to grow abnormally in the body, thus leading to a cancer. To keep these hallmarks of cancer in simple terms, the first is uncontrolled growth. So our cells are dividing in the body normally also. That is how when there is damage to the skin or any other tissue in the body, it gets regenerated. But this growth becomes uncontrolled. That means cells divide continuously. That is one mechanism which can lead to cancer. Another mechanism is evading cell death. So the cells do not die when they should die. The third is that they are able to ignore growth signals. So any cells in the body require signals, for example, hormones to grow at a particular rate at a particular time. But cancer cells are able to grow ignoring all these signals. They are able to go forward even without a green signal. Another mechanism is resisting anti-growth signals, that is ignoring the body's stop signals. There are natural mechanisms to prevent cells from growing out of control, but cancer cells are able to ignore these red signals. They are able to create their own blood supply and sustain themselves in the body by forming new vessels. This is known as angiogenesis. They can also invade and spread to other organs, which is called metastasis. The immune system in the body is able to the immune system in the body is able to match and look for and destroy cancer cells. However, cancer cells develop mechanisms to evade the immune system. They are able to escape from these cells and continue to grow in the body, and they're able to reprogram their energy metabolism. So they're able to use different pathways of energy and metabolism compared to the normal cells in the body. So a combination of all these factors, not necessarily all of them, is what results in a normal cell becoming a cancerous cell. Now coming to breast cancer. So this is the Globocan data. The breast cancer constitutes 25 to 32% of all female cancers, and in our setting, unfortunately, almost half of them report in advanced stages. What is staging? The staging is a terminology used by us oncologists to help explain how much the disease has spread within the body. A very broad overview of the staging. Stage 0 is just abnormal cells in their own place, that is called in situ. Stage 1 is a small tumor in the breast with no or minimal involvement of the lymph nodes. Stage 2 is a larger tumor or spread to a few nearby lymph nodes. Stage 3 has a little more lymph node involvement or a tumor infiltrating the chest wall or the skin. And in the fourth stage, the cancer has spread to other organs, that is the bone, liver, lungs, etc., which is called metastasis. Staging guides both the treatment as well as the prognosis, which means the chances of getting well. Most patients can be cured if cancer is diagnosed early. The chances of cure in stage 1 are around 85%. In the fourth stage, it is very difficult to cure the cancer, and most patients can only achieve disease control, not cure. It is also possible to save the breast if cancer is diagnosed early. What are the risk factors for developing breast cancer? So this is usually divided into modifiable and non-modifiable risk factors. Non-modifiable means these are going to keep happening naturally and it's going to be different for each person, but there's nothing that can be actively done about it. For example, with advancing age, it becomes more common. It is more common in women than males. There are certain genetic syndromes which predispose to breast cancer. An early menarche, that is an early starting of menses in women, and a delayed menopause, which are part of the body's natural process, are also risk factors, and breast density. Whereas there are certain modifiable risk factors, which means we can do something about it. One of these is central obesity. The other one is delayed first pregnancy. So the later the age of the first pregnancy, there is a slightly increased risk of breast cancer, and an early first pregnancy may be protective. Less breastfeeding is also a risk factor for breast cancer, and a prolonged breastfeeding is also a protective factor. Smoking and alcohol consumption are risk factors for breast cancer as well as multiple other types of cancers. And a prolonged exposure to hormone replacement therapy or OC pills may also be contributory. So, what are the symptoms of breast cancer? So, above, just to make it easier to understand, there is a set of oranges which we are showing the symptoms. I am pointing it out with my laser pointer. So, compared to the normal breast, feeling a thick area, a dimple appearing in the skin which was otherwise smooth, a change in the appearance of the nipple, that is a crusting of the nipple, any red or hot area on the breast, any new leakage of fluid from the nipple, development of sores on the skin, a bump on the surface of the breast, a visibly growing veins which were not being seen previously, a sunken nipple or a nipple retraction, which develops new, a change in the shape or size, a thickening of the skin like an orange peel, or any hard lump. So, the woman is the person who is best placed to know how her breast feels normally. So, as we get to the topic of breast self examination, we just want to add that each person knows their own breast. So, any change compared to what they know to be their own normal is what we're really looking for. And these are some clinical photographs taken with permission from certain patients just to give you an idea of what these changes look like in a patient. So, what we expect when we find a breast lump changes according to the age of the patient. In the younger age group, from 15 to 25 and 25 to 50 years, there are less chances of finding a cancer, and that gradually increases with age. So, in the younger age before 25, fibroadenomas, which are benign masses, are most common. Between 25 to 50 years, it could be non cancerous changes, it could be a cancer related changes. But at any breast mass developing in a lady at age more than 50 years is cancer until proven otherwise. So, what do you do when you find a lump? The first thing you should do is visit your healthcare provider, visit a cancer physician, or at least your primary physician, and ask them to examine you clinically. After that, considering the findings of their clinical examination, they may advise you for an imaging, which may be a mammography, a breast sonography, and also for a biopsy from the breast lump if required. I have just added some images of mammography to get an idea of what this looks like. And the image on the lower left side of the screen shows an ultrasound guided biopsy where a piece of the tumor is taken out. One, to confirm whether it is cancer or not. Secondly, to find out which type of cancer it is. So this we were discussing regarding what do you do if you find that you have a breast lump. Now we come to the topic of screening. So what is screening? Screening is the process of identifying disease in people without symptoms to detect conditions early when treatment is most effective. So screening as a concept is aimed at early detection and prevention of disease progression. It involves simple, cost-effective tests applied to a larger population, and it helps reduce mortality by detecting diseases like cancer at an early treatable stage. Why is breast cancer an ideal candidate for screening? This is a very highly prevalent cancer. It is, as we discussed, the most common cancer in women, making detection crucial. It is a cancer that is detectable in the early stages. It develops slowly. It allows time for detection before symptoms appear. There are effective screening tests available, as we will be discussing ahead. There are better outcomes with early treatment of the disease. So it's not always necessary that if you're able to pick up something earlier, results will be better. But in most cancers, it is true, and particularly in breast cancer. And early screening reduces the mortality, that is, the chances of death from breast cancer. If you're able to pick up the disease early, there are better chances of a longer survival and cure. So, what are the investigations used for breast cancer screening? One is breast self examination, one is a clinical examination by the physician, and one is a mammography in asymptomatic women. The mammography we discussed earlier was in the context that a woman has come to a doctor with a suspicion of a breast tumor, and the doctor has advised an investigation. The screening mammography is a different concept which is performed in people who have no symptoms but want to do it as a part of a routine health checkup, which we will discuss ahead. So, how do you go about breast self-examination? This is the simplest of the three forms of screening. So we follow the look and then feel approach. So look, you have to stand in front of the mirror with the arms by your side and then raise them up. Check for any changes in size, shape, skin, or nipples, whether there are any new dimples appearing, new swellings appearing, any redness appearing, or change in the shape of the breast on movement. Then first examine the breast by feeling the breast standing up. Use three fingers to gently press in a circular motion, covering the entire breast and armpit. After that, you can examine the breast lying down. Lie flat, place one arm behind your head, and examine the opposite breast with the other hand using circular motions. Check for lumps, thickening, nipple discharge, pain, or skin changes. And when do you do it? Do it monthly, preferably a week after the period. If postmenopausal, pick a fixed date each month so that you remember to do your examination. This is a diagrammatic depiction of the same thing that we discussed. First, stand in front of the mirror with your arms outstretched. Then keep your arms on your waist. Raise your arms above your head and see if there's any change in the shape and whether both breasts are moving the same. Then you can press over the breast, that is, feel, first standing up in a gentle circular motion, and then repeat the same after lying down. Now coming to screening mammography. And what is mammography? So mammography is a low dose X-ray of the breasts to detect early signs of cancer before symptoms appear. One breast at a time is placed on a flat plate and another plate gently compresses it. These are X-ray plates and images are captured from different angles. The compression may cause a mild discomfort that lasts only for a few seconds. A breast radiologist then examines the images for abnormalities like lumps, calcifications, or asymmetry. This is a diagrammatic depiction of the mammography process. And these are a few mammography images depicting abnormal findings just for reference. So those of you who have undergone either treatment for a breast cancer personally or have relatives with breast cancer or have undergone screening mammographies would be familiar with these images. So the radiologist is able to interpret the pattern of these calcifications and densities in the breast, and this is reported as a scoring system called BIRADS. This is a word with which people become familiar as they come into the spectrum of breast cancer, as I mentioned, from either one of these points being treated themselves or the other side undergoing a routine screening. So just for an understanding point, the lower BIRAD scores, that is 1 and 2, are totally negative, and 4 and 5 are the ones which are most suspicious for malignancy, where it's most likely that the doctor will advise you for a biopsy to check whether there is a tumor and also whether what kind of tumor it is. Then we come to genetic testing in breast cancer. So what do the guidelines say? Let me just give you a brief on what is genetic testing. So as we mentioned, there are certain hallmarks of cancer which develop, which allow the normal cells to become cancerous cells. Some of these are called acquired mutations. That means that these mutations develop by themselves over the course of a person's lifespan. Some of these are genetic mutations which are called germline. That means these mutations were present either in the parents or in the sperm or ova of the parents, and now they have been transmitted to the children. So that is called a germline mutation. So when do we suspect a germline mutation, which means something that is hereditary or genetically transmissible? The guidelines suggest that if there is a personal history of breast cancer, that is, the patient has been diagnosed with breast cancer, diagnosed less than 45 years of age, or diagnosed at less than 50 years of age with another cancer, personally or in the family, or any triple negative breast cancer, which is a type of breast cancer, occurring at an age less than 60 years, and any male patient with breast cancer. If you have a family history of cancer, then it is important to do a genetic test after consulting your physician. If there were multiple breast cancers in close relatives, ovarian, pancreatic, or prostate cancer in the family, or any known BRCA1 or BRCA2 gene mutation in the family. It is important because 10% of breast cancers are familial. The BRCA1 and BRCA2 genes are the most common mutated ones. And if BRCA is positive, there is also a higher risk of ovarian cancer And there is an option of a risk reduction surgery once the childbearing is over, which can provide over 95% from an ovarian protection from an ovarian cancer occurring at an older age group. However, it's important to understand that most cancer is not inherited. So, though there may be many people who have the gene, only one of them may actually develop the cancer. So, just having a genetic syndrome does not mean that you will develop the cancer. It just means that the risk is slightly increased and you need to be on a more intensive checkup and follow up. In case any disease develops over your lifespan, it can be detected earlier. So, if my mother, sister, daughter, aunt, or niece had a breast or ovarian cancer, what should I do? You can see if you have these risk factors for developing a genetic cancer syndrome, as we discussed earlier. And if BRCA testing is positive, a close surveillance and screening with an annual mammography, alternating with a breast MRI, consider a risk reduction surgery, that is removal of breasts, after a close discussion with your physician. And also, there are certain medicines which can reduce the risk of cancer. This is just a recap of the things which we can do to live a better lifestyle. Sleep well, eat healthy, maintain a good active lifestyle, avoid central obesity. And these are the things which are in our hands to prevent cancer developing. So your life is in your hands. Take good care of it. Say no to breast cancer and say yes to life. Catch cancer before it catches you. Thank you. We can now open the floor to questions. Yeah. So if there is a family history of breast cancer, it's important to first have a discussion with the physician. There will be a caregiver if you have had a patient in your family treated for cancer. Usually, the first point of contact with for you with the medical fraternity is the person who has been treating your relative. So you can have an honest conversation with them. You can express your concerns, and then after an appropriate genetic counseling, we can proceed. So usually, we first see whether there was any genetic testing done for the patient and whether they fit into any of the high risk groups. We suggest a genetic testing for the patient as warranted, and then we appropriately counsel the relatives regarding what their chances are and how important it is for them to do a genetic screening for themselves. So there are usually the genetic tests are done through a blood test. So it is not something that is very difficult or invasive or complicated to do. It's quite easy to proceed with that should you feel that it is indicated. So usually breast self-examination is something that we advise from a young age, from age even if 20 onwards, because women should be familiar with the feel of their own breasts. And that should continue throughout the life so that they notice if there are any changes that are developing. For screening mammography, the guidelines differ exactly on the age, but usually we start at an age of 40 to 45, and one yearly mammography is enough to proceed. It can, if it is negative consistently, the frequency can be decreased to even once in 2 years until an age of 74 years. This is for a general population, but if there are any specific high risk groups, then there is a different pattern of screening, and particularly in BRCA positive patients, there is also a breast MRI that has to be done at least yearly. So I'll just reopen my presentation here. Just give me a second. I think it's not. Sorry. Yeah. As we discussed earlier, a change in the feeling of the normal breast is the best way to express it. So when women do regular self-examination, the woman is the best person to judge if there is any change in the normal feeling of the breast. So either a new thick area, a new development of a dimple, a crusting on the nipple which was not there earlier, a red or hot area. Yeah, so there is also a new fluid leaking from the nipple, sores in the skin, a change in the shape of the breast, a change in the appearance of the veins on the breast, a new onset retraction of the nipples. So in some women, the nipple may already be inwards, but if a new onset retraction of the nipple occurs, that is something that should not be ignored. Any shape or size change in the breast, thickening of the skin appearing like an orange peel or a hard lump, all these things need to be looked into. Another point to add is if there is any persistent weight loss, or in general any persistent symptom which is not very well explained, like a persistent cough which is not going away, an abdominal pain, a little abdominal swelling, these things need to be looked into. So it's important to get a health checkup. It may not necessarily be cancer, but if something is not going away with your routine medications, it is important to look for causes that might not be so routine. Even after a checkup, if you end up not finding something, it's always better, but you don't want to miss something just because we did not get a checkup.